Were you aware that poor quality sleep can be seriously affecting your sexual function? This is Dr. Jose Ramirez, board-certified pulmonary critical care and sleep physician. Let me elaborate in this concept. Under normal circumstances, our testosterone usually peaks at night, and it does it on a pulsatile fashion, and it's usually at its highest during what we call periods of deep sleep. Anything that affects the quality, the amount, or the depth of your sleep is going to affect testosterone secretion. One of the most common sleep disorders known as obstructive sleep apnea, which basically means excessive collapse of the upper part of your airway during sleep, typically associated to snoring, is one of the most common causes of sleep interruptions and sleep deprivation. It has been consistently demonstrated that patients with obstructive sleep apnea will have lower testosterone levels. And testosterone is a male androgenic hormone responsible for muscle growth and repair, sexual function, erectile function, and adequate libido. If you suffer from obstructive sleep apnea, testosterone levels then are going to be consistently lower, and it will depend in the severity of the obstructive sleep apnea. It is very important to always investigate the root cause of a problem prior to taking additional steps, particularly pharmacotherapy medications that are used in cases of low testosterone, which tend to be jump to testosterone replacement. Please follow us to obtain more information in this important topic.